Well, in the country, one of the things that actually was on the table was actually improving reimbursement for primary care doctors. I think that's an incentive. I think it does discourage students. I hate to say that, but it does. Medical school is costly. One of the things about MCG is it's probably one of the least costly medical schools in Georgia. So the tuition, even though we've increased our tuition, is still lower than some of the other schools that are here in Georgia. So that is an issue. There's actually students prior to coming to medical school are often in debt from college. And so the cost of medical school makes them think about already the debt that they're in prior to coming to medical school and then more debt. And it kind of, I think, has some impact on what you think about for your future. What else students do is sometimes students decide to join the National Health Corps. National Health Corps is if you know that you're going to go into primary care and really where you want to serve is people that are underserved. They will underwrite the cost of your medical school education. So it's a really great program. We actually have a National Health Corps scholar here in the second year class. He's one of the first students in our class that was chosen for that because you apply for it and you get accepted and they pay for your school. And in exchange, you end up working in an area that's underserved, and there are plenty of areas that are underserved, particularly in Georgia. But I like to think that their primary incentive is then again the passion, because you really, whatever field you choose, you're going to be working really a lot of hours and hard, and you have to love what you're doing and the people that you're serving. So that medicine has to be something you're really very much interested in. I'm a pediatrician, and I really love working with young people, and I liked prevention. So that was one of the reasons why I went into pediatrics. Not so much even thinking about how much I'm going to make. For me, it was that this is what I want to do and this is what I love. And I like to think most students do that. I will say, though, that, again, the attraction can be higher for you, particularly if you do have a lot of money that you're in debt, to think about how much money am I going to make, and also hours. You have to think about the number of hours that you have to work. So primary care in general, you work a lot more hours. So the pay versus the amount of hours that you're working is not equal. Because you're on call a lot, you're in the hospitals a lot, and you don't really get necessarily the pay for that. And again, I will tell students that even though this is a lot of money, you do end up paying it back because there's no such thing really as an unemployed doctor. It's just how fast you make it and how much you make it, but you will always be able to make a living.